the governor of Mississippi, as you know, is someone who is very focused on making progress. And this governor has been on me like relentlessly relative to this subject. When are we having the conference? What are we doing? What are we doing? When are we going to do this? Because he didn't want any momentum to be lost. And so when he named Dr. Clay Hayes to be chair of the Institute back in the early part of this year, we began meeting in earnest on planning it, set the date, and have now been managing against it. And our next step will be launching this institute and getting it to the next level and really building on the partnerships like we heard today and developing that Texas-style attitude. So please join me in welcoming a leader with a Mississippi-style attitude and a focus on the future, the governor of the state of Mississippi, the Honorable Phil Bryant.
Thank you, Blake. Thank you. Thank you. Oh, please, sit down, sit down. You're in the middle of your lunch. You notice that's a pretty healthy lunch. Yeah, salad, baked chicken, skip the dessert. I'm just saying. Prevention. We've got to make you all healthy. Dr. Wernerdy and I were talking, what a phenomenal man. As someone who has run the largest medical institute in the country since 1984, has made it what it truly is. And we have had the great pleasure of having him here in Mississippi. Now, Blake Wilson is right. I guess we've had a few conversations this week about this and weeks prior leading up to this, texting and emails back and forth, but I wanted it to be so perfect for you. I wanted you to see the vision that I've seen. I wanted you to be a part of it. I wanted you to leave here today and say, Phil's got something here. I think we can do that. Because we have a tendency to sometimes be negative. I know the healthcare field is so challenging just now, and you feel overrun, and all the things that are going on in Washington, the battles within the state, but this is so critically important that we get it right. So I want to tell you a little bit about today of how this all took place. How did we get started? Let's see. Well, here's where we've been. We went to Houston, Texas, and Dr. Wernerdy met us there, and as you see, it's a fairly good-sized little city. He told you earlier how many people are employed, and that was the delegation. You see the Christmas tree behind us because we were there in December. This was before I was sworn in as governor. I was just getting ready. I was trying to, I was doing the inaugural speech. We're trying to get that address together. We were putting together a pretty large event called a swearing in or an inaugural address that day. We had the executive budget recommendation coming out, and then I was in Houston, Texas to see this, but that's where we were at. In my state of the state in 2012, that next January, I challenged Mississippi, let us be a part of this. I tasked the Mississippi Economic Council. Yeah, even then I was calling on Blake Wilson. Even in January 2012, I said, I've tasked him to study and look at how we can build greater economic development opportunities in healthcare. And for the first time ever, as you have heard, a governor said, we are going to put these together. We're going to take economic development, as we did with Nissan and Toyota and others, and we're going to overlay it, if you will, upon our medical community. So our health care becomes an economic driver in Mississippi. Oh, well, we're not sure we can do that. There's so many factors that are involved there. Yes, we can, we thought. So we went immediately to the Mississippi legislature and said, we've got to have a plan. We've got to design a system where we drive the economy of health care throughout the state of Mississippi with incentives. We've done the same thing for the automobile industry, for the aerospace industry, for the shipping industry, for agriculture, everyone. So then we all came together in an effort called Mississippi Works in the Healthcare Zones, House Bill 1537. And it basically says if you have an opportunity to incentivize someone, it provides 25 jobs or an investment of $10 million within a healthcare zone, we are going to do that. Now, we particularly picked out things like medical supply companies, and because those are really good jobs for people who perhaps want to be in the medical community but are not doctors, not physicians, not nurses, but medical supply manufacturers and providers, biologists, medical products distribution. We're doing some of that. Y'all heard today how some companies throughout the state of Mississippi are taking advantage of having a distribution warehouse, for example, in DeSoto County. And so we're sending out a lot of the manufactured systems and products there in DeSoto County is doing such good. Laboratory testing, diagnostic imaging, pharmaceutical research and development, huge industry. You know, so much of this goes on in the city of Boston. When I was there, I thought, how in the world did Boston get it? Well, a lot of it started years ago when Massachusetts actually had a welcoming environment. And so they all began to build these large pharmaceutical companies there, and they stay there. But it doesn't mean that they won't leave if we give them the opportunity, if we create an environment that we have through our Mississippi Works Project and our healthcare industry zones to be able to come here to the state of Mississippi. They will, in fact, do that. What is a healthcare zone? Well, we had a little challenge trying to say, what is one? Now, I could look at the Houston, Texas model and say, I can assure you that's a healthcare zone. That's a healthcare city. But what was ours going to look like? So we said, if we need to, let's collaboratively work together. Let's join 3 counties with 375 acute care beds and allow them, if they will, to work together to become a healthcare zone. Now, there are some areas like Jackson that was pretty easy for, but I will show you in just a few moments how some of our counties that you might not expect work together to become a healthcare zone. They put their plans together, they hired a consultant, they have it working, and we'll show you the incentives of why that's taking place. What incentives are available? Well, if you look here, receive a sales tax exemption for the date of the certification. When you become a certified healthcare zone, you begin to be incentivized by sales tax reductions. Now, people argue, oh, well, that takes money from the general fund. Every time we give people incentives, you know, our general fund. No. I learned from a guy a long time ago. And he said if you use targeted tax cut to incentivize businesses, you know what happens? Those businesses grow, and they hire people. So now you've got income taxes, you've got property taxes, you've got more sales taxes because the products they're building are selling. That guy was named Ronald Reagan. Yeah, they used to joke about him. Oh, that poor guy, he's an actor. He doesn't know anything about the economy. Remember the 80s? Worked out pretty well for him. Yeah, the things that you reduce the tax on and use that tax to incentivize growth have a tendency to grow. Those things that you tax have a tendency to go away or you sell less of them. That's one of the ideas that we used when we were developing this. Also, a 10-year state income tax depreciation deduction, so we can help you depreciate the cost of your income tax for your employees across the state of Mississippi. Again, a $10 million investment. We allow cities and counties to be able to grant you some tax exemptions also, so in lieu of tax exemptions, if you will. Give them the authority to do that. And certified companies can also qualify for other incentives. For example, we've used some CDBG money. We used $10 million of CDBG money to be able to begin the construction of the new medical hospital or the medical school at the University Medical Center. So there are other opportunities. We've used funds from Katrina, for example, in the area along Picayune, Pearl River County, to help build some of the infrastructure there. There are programs within our economic development incentive programs that you can take advantage of now with our new Mississippi Works program that perhaps would not have fit a medical facility in the past. Now, Blueprint Mississippi, as we talked about that plan, as we were moving at a lightning speed, and believe me, we were moving quickly. I like to do that. I don't like to wait. If we continue to wait, this window of opportunity I believe that we have to make this an economic driver for the state of Mississippi will go away. Look, we're competing with Alabama, with UAB, with Bobby Jindal over in Louisiana, a guy named Rick Perry. Thank goodness he's leaving. Rick's a tough competitor. He wants every job from California to Illinois. And he intercepts them when they come across. Yeah. I mean, if some guy's heading from California to Mississippi, Rick grabs them up, pulls them in. Come look at Houston, Texas. We got the best medical city in the world. Don't go over there. No, he's not that bad, but he is. So we said, here's our blueprint. Workforce development, obviously, using community colleges. My wife has a community college degree in medical records. She worked 38 years for St. Dominic's Hospital in quality assurance. So those young blue-collar kids like me that went to a community colleges can go there to help a workforce development to go into the healthcare industry. Quality of life, we've talked about it. Making sure now that we start with prevention. You know, we lead the nation in obesity. We're going to stop that. I can just tell you, we're going to turn that around. Just the other day, I was over at Pearl River Resort. I can't tell you much about it, but the biggest loser was there. The the television program, and I hope we can involve all the state of Mississippi. I'd like to take all our government employees and compete against Texas or Florida or somebody else and say, let's see how many pounds we can lose, and have a national competition on the biggest loser. We're going to do that. We've got to get diabetes under control. My mother passed away because of the complications of diabetes, terrible disease. My dad, as you heard earlier, was a heart patient. It just seemed that generation had so many challenges, but now so do we. And our children's health care will be worse than ours. Unbelievable. Prevention is so important. Business sustainability, healthcare workers reduce lost time for illness, of course. If we can keep you well, you saw the model that Ingalls has. I will tell you that model will expand across the state of Mississippi. Toyota has a clinic. The Beau Rivage Casino has a clinic right across the street. I visited it. They saved about $2 million the first year on their insurance premiums by having their employees go across the street, take that primary care, and many of them were able to come back to work or on their way to work go into the clinic. You're going to see that model expanding. I hope that the state of Mississippi will have one soon in the capital area so we can offer our state employees the same opportunity. I'm working on that now. Primary care. And look, we maintain your insurance. So if you have a serious health care challenge, you're still covered by that, but we're going to develop that primary care for you and help reduce that cost to the visits to the physicians and coordinate with local physicians so we're not in competition. Look, this idea of competition is somewhat amazing to me. They'll say, you know, if you put these other FQHCs, federally qualified health care centers, and other in areas, you're going to compete with physicians. As you heard earlier, the demand is so great. If all of us that are in the baby boom generation decide to go to the hospital or to the doctor at the same time, it'd be impossible. We would be 6 or 8 months trying to get a visit. So I think the sustainability is important, creating of economic wealth. Every doctor that goes in every community brings about $2 million with him or her. Let me say that again. Every physician you can get to move into your community will bring about $2 million economic impact with them. If I was a mayor, I'd go find me 10 doctors. I would quit worrying about the local option sales tax, and I'd find me 10 doctors. And I'd just do whatever it took to move them into my community and help them build a clinic, start hiring nurses and providing health care because they get $2 million. Where are we going? There you see on the top, we were opening the new medical school for the University Medical Center. Dr. King is here. The osteopathic medicine school at his wonderful university, William Carey, is doing remarkable things. And that almost went unnoticed. You know, I talked to a lot of people about that school of medicine there, and they go, what? Where? In Hattiesburg. When did that happen? It's wonderful to see a university that's so dynamic, that's so aggressive, that they can take on that type of challenge. Now, if we were trying to do that for another public university in the state, I'm going to tell you it'd take 20 years, and blood would be on the floor of the legislature. Oh, my goodness, we can't do that. They'd say they'll be competing with the University Medical Center, and then we'd have to try to fund both of them. Dr. King just says, yep, starts it, gets one going. Amazing. That's where we're headed. 1,000 new doctors by 2025. Not just with to take the place of the 1,000 that will retire, and many of them will. I can assure you just now, I talk to them every day, and what's going on in the federal government with the Affordable Care Act, a lot of them have said, I'm done. You know, I can retire, I'm going to sell my clinic and get out of this. We've got to have more physicians coming in, whether you know it or not. Some of them are getting a little older. And so we're going to find 1,000 additional, along with the ones that we're going to create there. You look at the medical school, 151 square foot facility, 930 jobs during construction. 930 construction jobs. I mean, if we did nothing at all in this conference today, but all of us agree that we're going to build a new medical school and do whatever it takes to get there, it would be a success. Well, that's already being done. We're going to be there very soon. And I was handed, I was in the hallway networking. There was many people in the hallway networking as there were inside. That's a good thing. I've got a pocket full of cards, and every one of them would just like to see me for 15 minutes. And I just get 15 minutes, I promise you. One has a plan. Look at this. This is a plan for affordable housing, a beautiful facility near the University Medical Center in St. Dominic's, just up the road here. This is a beautiful mixed-use facility that we're so close. This private sector company is so close to building. I just picked this up in the hallway. No big deal. 250 units there. Mixed use, offices, work, live, and play. Sure, we can do that. Yeah, that's going to be our new motto. We can do that. I think somebody might have it already, but that's okay. I borrow good ideas. Mississippi Healthcare Solutions. So I thought, we need this Chamber of Commerce for healthcare. We've got some amazing organizations out there. The Mississippi Medical Association, Mississippi Hospital Association, dentists. I mean, everybody's got an association, but I wanted this Chamber of Commerce for healthcare. And so I said, why don't we just make one up? Well, I mean, why don't we do some real hard research and think about it? And then I said, well, I like to just rather make one up. So we said we're going to create this Mississippi Healthcare Solutions Institute, that's CSI. Everybody knows what that is, but we're going to get everybody that's involved to be a part of it. And this basket is full of them. It's full of stakeholders that will be a part of this. Now, this organization will wake up every day driving healthcare. As you know, Clay Hayes is the first president of it. We'll have other presidents in the future. It'll come out of that basket right over there. One day we'll find an executive director, and every day that his job or her job will be able to wake up and say, how can I use health care to make an economic driver? And you will be able to call and say, I need your help. I've got something going on in my community. I need you to come down here and convince this company to move here. I want you to be a part of this. And zoom, we come in, we get to help them. It's going to be a part of MEC's great facility. Now, what have we done so far? Well, let's look at this. This is the Methodist LeBonner Hospital in Olive Branch. Nice little facility up there. We were able to put some CDBG money and support that. It's going to be $137 million, only $137 million investment in Neshoba counties. That's a little one, $19 million investment. Teleflex Incorporated, we were up there to open that in Olive Branch, Mississippi, a leading global provider of medical devices for critical care and surgery. One of the first that we were able to incentivize, I believe, under our new Medical Zone Act. So Teleflex is working. Highland Community Hospital in Picayune, Mississippi. I particularly like that one. I don't know why. Just Pearl River County, and not a lot of people know that we've got a brand new hospital coming up in Picayune, Mississippi. I was down there touring it when they were opening it up. Choctaw Indian Hospital on the Pearl River Reservation. I was with the chief the other day, and she was telling me about this new hospital there for the Choctaw Nation. We ought to be very proud of that. They're going to build that hospital. Now, as I know the challenges of hospitals every day to see these great pioneers and courageous men and women that are saying, we're going to build another hospital. We're going to build one here at the Choctaw Indian Reservation. The expansion of the Baptist Memorial Hospital in Oxford, Mississippi. Expansion of the University Medical Center. We've talked about that. Baptist Healthcare System in Belhaven. I don't know if any of you have seen that building down there. It went up, but it's amazing how quick it went up. It seems like every week or so I drive past there, and that building was it's bigger than the Baptist. If that's an extension, I don't know what the hospital is now. It is amazing to see. Now, imagine how many people are going to go to work in that facility. Now we said, okay, people like to live close to where they're working. I know this is hard to believe, but people don't like driving down Lakeland Drive. They don't like going I-55 north 45 minutes to get to work every day. So what we need to do is develop an area that people in the hospital can work and live and play, that multiple use design that we've heard so much about. You saw some earlier that states are doing. So I went to the Mississippi Home Corporation and I said, how do we do this? How do we, as we incentivize developers to come in and put in workforce housing, how do we do it? Well, we give them particular points, and the higher the percentage point, the better tax credit they get. And the percentage points can be worth hundreds of thousands or millions of dollars. So I said, well, I've got an idea. Who controls that? And they said, well, you get a shot at controlling that. You're the governor. Great idea. I said, what's the highest point you can get? They said, 15. Let's put that in a medical zone. So if you build a house in a medical zone or you build homes, workforce housing to support veterans, you get 15 points. So just get ready. We're going to start building some affordable, brand new homes something you'd be proud for your children to get married and move into and get out of your house. In medical zones. Now, to do that, you've got to be a certified medical zone. All right, so again, we talked about that earlier, and people said, oh, it's pretty hard to do. You see how we go about giving the awards for that, and one of us has been that accredited American Institute of Certified Planners, so you've got to have a real AICP come in and help you put this plan together. You've got to go to the Home Corporation. They issued $11 million worth of credits for this new housing within workforce development, within the hospital zones. Economic impact of these credits will be $131 million. So they take those credits. You come in, you say, I've got my master plan. I'm in a healthcare zone. And so here's my developer. He wants to build some new workforce development homes within a 5-mile radius of my hospital. We send it to you. Boom. They take it to New York. They sell it to somebody. They get money. They come back and build houses. And then they lease those houses out or sell them, and they make money. It's called an economy. And it's directly related to health care. So we were able to do this. Now, say, okay, well, I guess just the people in Jackson, maybe Meridian, Tupelo are able to do this. No, the healthcare zone master plan that you have to have is somewhat challenging, but we wanted it to be. If you see there, everything from the environment to healthcare district zone site master planning, overlay district regulations. Once it's complete, though, you have an opportunity for all those things. Pharmaceutical companies that might come in, medical supply companies, we talked earlier. But the fact that they're within this particular zone where economic development, learning, healing is all taking place. How many did we have? Well, there they go, 12 of them. 12 healthcare zone master plans. Now, this is not just a master plan that will help you build affordable housing, although you have to have that to get that 15-point credit, but it also prepares a business plan for these communities using health care as an economic driver. Now, hear me. They've got a plan that their mayor, their board of supervisors can pick up and say, okay, we want to increase the economy and health care in our town, in Yazoo County. How do we do it? Well, we've got a plan. And we even had a master economic development planner come in and do it for us. I like plans. I like to work my plan my work. 12 of them out there right now. Clark County, Clay County, West Point, Mississippi. What else they have coming? Yokohama Tire Plant. So Clay County, that everybody predicted was dead a few years ago. They said, forget about West Point. It's gone. Clay County will never recover. Bryant Foods left. It's just good. They've got a master plan to make healthcare an economic driver, and they've got Yokohama Tire Plant Company coming. Amazing how things turn when you put your shoulder to the wheel. When you forget about other people telling you can't make it. When you stop listening to the complainers and start listening to those that are excited about the possibilities. When you get the governor and MDA and other folks involved with the idea that we can do something very special. Yokohama Tire Company started out looking at 3,000 counties in 13 states across the United States. 3,000 counties. They ended up in Clay County, Mississippi. Now, we can do that. We can do this. We can do anything. So I'm so very proud of these communities and what they've been able to do. Hancock County, Humphreys County, Belzona, Mississippi. Now, I'm just going to say, if I'd given you a list of cities and then said, now, which one of these do you believe will be a certified health care zone? You probably wouldn't have picked Belzona. I'm just going to take a wild guess and said that might not have been on your list. They went to work. Humphreys County's got this done. Marshall County, Montgomery, Noxubee County, Panola, Scott, Yazoo County. Phenomenal work that they've already been able to do. So what they had to do was say, we're not Jackson. Jackson's already qualified. They've got enough acute care beds. They have the expansion. They have the economy. They have the infrastructure. But we want to be able to say that Humphreys County can do it as well. And we said, well, to do that, you've got to have that master plan. And they brought it to us. Great things are happening out there. Dr. Winerdy said it early, and as I sat down next to him, he said, you know, I travel all over the country now, and I don't see any other state that's doing what you are doing. here in Mississippi. Now, for someone of the caliber of Dr. Ornerdi that has achieved what he has achieved, unsolicited, to tell us that we are leading, that we're doing better than other states in making sure that we have a healthcare industry that's leading as an economic driver is a phenomenal endorsement of this plan. Thank you, Dr. Nunn. So, it goes on. Now, I can tell you there will be other summits, there'll be other efforts, there'll be other challenges. There'll be people that will say, well, gosh, we went to that summit, but what did you get out of it? Didn't happen today. It's going to take some time, but we are going to achieve great things. We have to.